Dr. Redacted back, and before we get started, if you have arachnophobia, leave now. I am not kidding. Leave. I'm giving you plenty of time. This SCP freaks me out. I helped contain it, but I have not stepped back foot in the lab where it is. And yes, we had literally made it its own wing. Not really a wing, it has its own room in the freaking biological containment sector. This is not something you fuck with. SCP-632. Object class safe, my ass. I've lost 3 people to it. Special containment procedures. A live colony of SCP-632 is currently kept in a 20 cm by 40 cm by 20 cm sealed enclosure in the biological containment wing of Site-52. Yeah, that's what it has to be kept at. We had it behind 4 locked doors. I'm not kidding. This thing freaks the shit out of everyone. Continuing. Sufficient amounts of prey insects and water must be administered weekly through a vacuum chute at the side of the enclosure. Both live and deceased samples of SCP-632 must be handled by personnel wearing full-body respiratory protective gear. Skin contact with SCP-632 is to be avoided at all times. At all times, at all cost. If you get it on you, I've had someone jump into the freaking incinerator to avoid what comes next. Personnel reporting headaches and sensations of spider silk on the skin and intrusive thoughts about spiders must submit to MRI scans to determine the presence of SCP-632 manifestations. Affected individuals are to be sedated and restrained before the onset of late-stage manifestation, and any newly formed SCP-632 instances are to be surgically removed. Uncontained instances of SCP-632 in the wild are to be destroyed on site. We made a new flamethrower that would burn hot enough to instantaneously turn them into dust. Okay, let me just tell you what they are so you'll understand. SCP-632 is a type of arachnid that produces via unconventional means. Yeah, no fucking kidding. Mature instances measure 10 to 15 millimeters in length and are highly social. I've realized now that someone else has come along and redone this page after I wrote it. Yeah, that figures. I'm pretty sure the screechings of how they are ungodly abominations did not help. Let me recontinue. SCP-632 is a type of arachnid that reproduces via unconventional means. Mature instances measure 10 to 15 millimeters in length and are highly sociable, living in colonies numbering up to 500 individuals. While the exoskeletons of SCP-632 instances is composed of a substance resembling calcified fat, the interior is almost entirely derived from differentiated human brain tissue. Yeah, that freaky as fuck. SCP-632 is unusual among arachnid species in that both male and female SCP-632 are physiologically similar. Sexual organs of both appear to be merely vestigial, likely as a result of its reproductive methods. SCP-632 reproduces by exposing a human host to an array of sensory triggers. Such triggers include the visual patterns of SCP-632's abdomen, the tactile sensation produced by SCP-632 crawling on human skin, and several as yet unidentified chemical compounds released by mature SCP-632 instances. Yeah. 2 to 3 hours following exposure to all of SCP-632's sensory triggers, affected individuals will experience mild headaches and sensations of spider silk on their skin, and repeated intrusive thoughts about spiders. MRI scans at this stage of infection reveal the presence of hundreds of small filament-like structures measuring 2 to 3 centimeters in length, forming in the frontal cortex of infected individuals' brains. The pressure exerted on the cerebral blood vessels by these structures causes headaches in the affected individuals. Localized toward the front of the skull, repeated tapping on the affected area causes the filament-like structures to release large amounts of endorphins, effectively alleviating the pain caused by their swelling. Growth of such structures can be halted via timely administration of Class B amnesiacs. However, While this method prevents total SCP-632 manifestations from occurring, it does not cause existing symptoms to abate. As SCP-632's manifestation progresses, affected individuals will experience gradual thinning of the anterior brain lining and skull, as bone, muscle, and fat tissue is gradually incorporated into the filament-like structures in the frontal cortex. 6 to 7 days following initial exposure, headaches experienced by affected individuals will increase sharply in intensity and duration. This is due to the filament-like structures having already developed fully into instances of juvenile SCP-632, which greatly exacerbate the pressure on the cerebral blood vessels via their movements. Affected individuals at this point tend to apply increasing amounts of force to their heads in order to release enough endorphins to reduce the pain to tolerable levels. Eventually, most affected individuals end up fracturing their own skulls through accidental application of excessive force. In other words, they beat themselves to death. At which point, 80 to 200 instances of SCP-632 will exit from the brain from the weakened point in the forehead. Yeah, this is not something we deal with lightly. We bring flamethrowers on purpose. Actually, we didn't invent them, the Nazis did. We just used something that they thought was too insane to use. Whew. I don't like this at all. Complete SCP-632 manifestation is usually fatal. However, if promptly attended to by qualified medical personnel, 86% of hosts in the final stage of SCP-632 manifestation do survive, albeit with a permanent decrease in motor function, reduced impulse control, and severe arachnophobia. I'm not kidding. I saw a man jump down into the incinerator chute to avoid this. If you have arachnophobia, you need to be off this case. If you suffer from any panic disorders, you need to be off this case. You only need to have a clear, sound mind to be on this. If you believe there is a problem, talk to the O4 above you. I don't care if I'm no longer qualified here. Gary, shut up. Gary's my guard, sorry. He's telling me I was not qualified to actually tell you to do this, but I am qualified. I worked on this. This is not something you want to be around. I don't know why we keep them. Actually, I do know why we keep them. We're hoping that we can derive some type of medication from some of their compounds, because it actually increases the growth of neurons. We're hoping to... yeah. Anyways, guys. This is Dr. Redacted going out. Yes, Gary, yes, okay. Shut up. You would not believe how comfortable you get with a guy pointing a gun at you all day. I feel like a month or two, it's kind of normal. Anyways, Dr. Redacted signing off.